It is a fat storage disease that many of you know is under-recognized, underappreciated in the US, but pretty much worldwide. It's under-recognized. It is one of several different fat storage diseases. Other ones are Durkheim's disease, adiposis dolorosa, Madelung's disease. We don't learn about it in medical school. That's a really unfortunate thing in the United States. It commonly is genetically inherited. There seems to be an autosomal dominant inheritance pattern with lipedema. So it does tend to run in families. It presents typically in puberty or the teenage years, and then tends to get worse, either slowly over a person's lifetime, or many times there's rapid increases in disease activity with hormonal changes, pregnancy, menopause, OBGYN surgery. It can increase in activity. It was ironically identified at the Mayo Clinic in Rochester, Minnesota in 1940. There was a landmark paper about it, but it was pretty much ignored. And there has not been a lot of work done, at least in the U.S., towards lipedema, but things are hopefully starting to change. The last few years, there's been a number of a lot more increased awareness, a lot more attention to lipedema, a lot more sharing of information like this about lipedema, a lot of Facebook groups, social media groups that are educating patients about lipedema, and hopefully insurance companies will start to recognize it as a disease, and it will gain the respect that it should as a disease. There is a characteristic look to lipedema. There's different stages of lipedema, 1 through 4. There is a characteristic look to the common type of lipedema. Typically, it's a column-like look to the legs in patients from their groin area all the way down to the ankle area, and the fat encircles the leg, typically all the way around it, which is an unusual thing. In the years of liposuction I've done, for example, the calves and ankles in people that do not have lipedema, that fat does not usually encircle the leg like it does in lipedema. Most of those patients also have upper arm involvement. Sometimes there's also involvement in the forearm area too, and then there's less common areas that are involved in lipedema. The upper buttocks can be actually quite commonly involved, the hip area also, and then less commonly the abdomen, the neck can be involved in it. Swelling is one of the common symptoms. That's why the term lipedema, the fat and the swelling too. There is commonly pain of varying degree. Sometimes there's basically almost no pain. Sometimes the pain is really immobilizing to patients. Easy bruisability commonly goes along with it too. The swelling in many patients either is stable or will go up and down during the day. There are a number of educational websites out there on lipedema. I'll just name a few. I think Karen Herb's site is fantastic. It gives a lot of information about it. There's a site, Lipedema Simplified, that's also an educational site. Lip Lady Fab has a lot of nice information out there. Lipedema, Cure Lipedema has some nice information. I also have a website called Advanced Lipedema Treatment, which is focused on lipedema, that gives some nice information too. Medications have been used against it, but have only limited success. Supplements can help with it, but again, limited success with it. Compression therapy, very important to help stave off the changes that can occur with lipedema. Things like MLD therapy, other compression therapy to reduce the swelling and to help reduce the fibrotic changes. Liposuction definitely has an important role in lipedema, not only for the cosmetic improvement, but for the functional improvement that goes along with it too. There usually is a dramatic reduction in a lot of the symptoms, sometimes almost immediately after the surgery. There's also the preventative aspect. The fat does not tend to come back, and it prevents the ongoing process of lipedema too. I will do a video a day and answer questions that are sent, and hopefully we'll fill in a lot of blanks about lipedema for those of you out there, and I very much look forward to continuing to help the community and educate and lead in the awareness.